so ready. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course. Bob.
Number one food that causes high blood pressure. Plus, we're going to give you the new guidelines for blood pressure that were, I think, just established just last year, Brad.
Yeah, I'm really happy you brought this up because this is something I'm interested in, and I think everyone.
It's a little controversial.
Right.
So
Over the age of 40, you're probably thinking about this.
Yeah, so we're going to present both sides. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. And Brad is missing his cue. He's supposed to have the Facebook sign over here.
I've been doing that all day long, Bob.
In case you haven't already, please make sure you sign up to us on Facebook. You like us because Brad and I, as children, we're not liked. And we're trying to turn things around, so it's Bob and Brad. All right.
There you
got
go.
the cue. All right, we're going to keep you hanging a little bit here, Brad. You know, we're not going to tell you the food quite yet. We're going to first talk about why blood pressure is a problem. Third, in the United States, people in the United States have high blood pressure. High blood pressure can damage your eyes. It can damage, obviously, arteries. It can cause you strokes and heart attacks. It can thicken the heart wall because the heart is working harder.
Sure.
And that can cause problems, and it can damage your kidneys. So, you know, it's not something you want to dismiss by any means.
Right.
And so we'll talk about the guidelines and what, you know, could be a problem.
Sure.
Now, if you want to measure your blood pressure, we found an instrument here that actually works pretty good. This is the blood pressure monitor by Nursal, Nursal. Very simple to use.
Sure.
You want to make sure you got the right cuff size. You want to make sure it's hooked up too, by the way. Because if the cuff is too big for you or too small, it's not going to take an accurate measurement.
Sure. You want me to hold on to that?
Yeah, if you want to hold on to it. You know, really all you need to know is that you can turn it on and you can turn it off. There's the orange button there.
Right.
There's other things you can keep track of different measurements for like you and me. You know, we could go P1, P2, but right now I'm just keeping it simple. If you
Right.
want to
Yep. Let's do that.
read the instructions, you can go ahead. But all you got to do is you can take the cuff here, and there's a little round indicator here. That's where you're supposed to put it over the brachial artery. The brachial artery is on the inside of the arm here. So if you get close to that area, you're pretty doing pretty
Yeah,
well.
you don't have to be exactly over it.
So I'm going to get over into this area here. And then when this comes around, this index thing is supposed to be, you're not supposed to go past this line here.
Yeah.
And it tells you all this in the instructions.
Yeah,
Go ahead.
These are things, no matter what manufacturer you get, you want to look and make sure that it's set up properly so you get an accurate reading.
And you want to follow all the guidelines. For one thing, you want to make sure you've been resting for like 5 minutes. You don't
Right.
cross your ankles.
Yep. You should be seated in a 90-90 position to be consistent.
Yeah, make sure you just didn't recently were done with exercise or eating, even if you ate like recently. So all those things. So I'm just going to go ahead and hit the on button, and it's going to take a few seconds here to you know, inflate the
Sure.
the cuff.
Yep.
And by the way,
just sit up nice and tall there,
Sure.
Bob. I'm going to get picky on you.
And what I did with this, by the way, is I took my blood pressure manually. So I used a stethoscope, and then I took it with this. And I found this was consistently a little bit lower.
Okay.
But in its defense, anytime I have my blood pressure taken somewhere else, it's always lower than what I take it.
Okay.
So it may be actually fairly accurate. The other thing is I took it many times with this, and it was very consistent.
Right. That's a big thing.
Yeah, that's the big thing. So, you know, you can compare it to maybe what the doctor says, but this gave me the same numbers each time. So my lower number is a little bit higher right now, 121 over 82. Normally I am lower than that, so
Okay.
I'm sure I'm a little bit nervous. You know,
Right.
doing
Well,
this.
we got millions of people watching you,
That's
Bob.
right,
Watching
millions and billions. So anyway, so the easy way to do it, we'll put a link down below. I like this. It's a fairly inexpensive unit for 20-some bucks. I think it's a good way to monitor your blood pressure.
Sure. Again, I used one of those once, and I was consistently high for a few weeks. And I went in, and I found out that I was just fine. That my monitor, my electric one, was just reading high, but at least I knew it was fine.
Yeah.
I was just high.
So it was consistently high then.
Right.
So they'll even sometimes put a monitor on you for 24 hours. Because there's a lot of people that get that white coat syndrome where they go in to see the doctor and the blood pressure gets
They're always
goes up
high because they're nervous because they're in there the doctor's office.
And the one doctor mentioned even that they put a monitor on this one person, and like 1 minute after they leave the office, the blood pressure go down.
Oh, when they were monitoring
Yeah,
it,
yeah.
sure.
And
yeah.
right 1 minute before they went in there, it went up. So it was
Yeah.
kind of interesting. All right, let's get to the number one food, Brad. I think most people think it's salt. And salt can be a problem. I know that some people try to downplay that, but I mean, I saw it with my wife. She was taken to eating this broth that had high salt.
Sure.
And her blood pressure just
Went
you know,
up with the
with the usage
broth
of that.
intake,
So,
up with the blood pressure.
but really, what some of the studies are showing now is that actually that refined carbohydrates, sugars, especially high fructose corn syrup,
Yep.
which you find in everything. I mean, a lot of processed foods.
Sure.
Look in your ingredients. This is really causing a lot higher incidence of diabetes, but it's also resulting in higher blood pressure. So that's
Right.
the one thing. It's really not good for you. I mean,
No.
you really want to try to avoid it as much as you can. And again, you're going to find it. It's in some cereals. It's in.
Oh, yeah. Just look on the ingredients, and the ingredients. I think most everyone knows is the first few ingredients. They're the highest in concentration, and you'll be that high fructose syrup is up in their top few ingredients in many products.
Yeah, it was a less expensive way to manufacture food, and of course, so
Precisely.
it became very prevalent.
And
so
it tastes good. It's sweet.
it tastes good. So
People
but
like it.
I'm telling you, if you want to make one change to your diet, that would be it. We're going to name a couple other things that might be surprising to you. Another one is you have to watch your alcohol intake.
Sure.
For men, they recommend not any more than 2 drinks a day, and for women, not more than 1. So.
And if you're going to have not the big 44-ounce beers, that wouldn't
Right,
count as
right.
wine.
That's a good point. They have size recommendations.
Sure.
For what counts as 1 drink. So yeah, if you get that wine glass that, it looks like a.
And you fill it up to the top.
Yeah, you fill it to the top. You could put a whole bottle in there. The other one probably is not any surprise to anybody would be smoking. I mean,
Sure.
Smoking is going to definitely raise blood pressure. So let's get to the new guidelines here, Brad. Where did my marker go? I thought
That's right here, Bob.
Oh. We're
Right.
really, okay.
There you go,
I just
yeah.
like to have a marker when I'm going to stand up, Lonnie, if that's all right.
If it cuts his head off, don't worry about it. They can look at me instead.
So these are new guidelines that came out. What they consider normal now is 120 over 80. And if you're below that, keep up the good work. You're doing a good job, okay? I'm just going to go by what they're recommending on this,
Sure.
and then we'll talk about some of the opposing views of it. So it's considered elevated if you're in the range from 120 to 129 or 80 over 80. So this is, again, systolic over diastolic.
Sure.
The one that I tend to find, changes the most from depending on, what kind of stress you're on is the upper number.
Sure.
The lower number seems to be a little more stable. Have you found that to be true or not, Brad?
Yeah, I don't have any input on that.
On that, okay.
Right.
All right, high, now they got it kind of broke down into stages. High stage 1 is if you're in the 130 to 139 for systolic and 80 to 89 for diastolic. So can you read these okay, Lonnie? Thumbs up?
Is it coming through?
All right. High stage 2 is 140 or higher, 90 over or higher. Then you could be in that stage 2. So if you're in, if you're in the elevated, you want to keep an eye on it. You're going to start monitoring to make sure it's not getting higher. If you're high stage 1, this is where you want to make sure you may be making some lifestyle changes, getting rid of that high fructose corn syrup, maybe exercising more, sleeping more, getting stress out of your life.
Right.
Or you may want to start taking medications.
Sure.
At 140 over 90, they do recommend taking medications at that point. And, this is called a hypertensive crisis, is when you're at 180 over 120 or more. And I've had patients that have been there.
Right.
So,
yeah. Then it's time to get that down and get.
Consult the doctor immediately.
Right.
So,
Right.
but now, having said all this, there was a kind of a rebuke of this and it was in JAMA, J-A-M-A, and if you're in the medical field, that's a highly respected journal. Yeah. By the University of Sydney and Bonn University, and they're saying these guidelines could be a little bit dangerous because what they're finding is that one thing, systolic blood pressure, which is the top one, has poor reproducibility. In other words, a lot of the monitors do not monitor it correctly.
Sure.
And so that you may getting some numbers that are not really accurate.
Right.
And so you're going to make recommendations based upon inaccurate numbers.
Sure.
The other thing they're saying is that 80% of the people, if they were diagnosed as hypertensive under these guidelines, they would get no result or no benefits from going on to the medicine. They'd be better off just not going on the medicine themselves.
So the medicine was not bringing the blood pressure down?
Well, it would bring it down, but they're saying is they didn't have any other risk factors, and so that they really didn't need to be on the medicine.
Okay, so with high blood pressure, you look at more than just that number. The doctor should be looking at some other symptoms that the body may present with.
Yeah, they just said that, right, exactly. If you got the high blood pressure, the doctor should be looking at the other risk factors that you have to say, hey, yeah, you got high blood pressure, but everything else looks fine, so maybe we really don't need to. And that's why you need to have your doctor involved on this. We're not trying to, I'm just saying don't panic if you're in these numbers.
Right.
Go see your doctor then and to discuss it with them and say, do I really need to be on medication, or there's other choices? Do I really have risk factors? So,
right. Yeah, I don't know if I should bring this up now, Bob, but 30 to 40 years ago, I don't remember the date, but at one time, this 140/90 was considered
normal.
Okay.
Yep. No,
right.
I remember this. I actually remember those numbers being fine.
And so, well, I don't know, at that time, were people dying left and right of heart attacks or having strokes? I don't know what the correlation is, but I actually had these numbers when I was in my 20s, late 20s and early 30s, and I changed my lifestyle to bring them down. I didn't use any medication, just basically aerobic exercise.
Sure.
Took care of it very nicely.
Yeah. So I mean, we're telling you not to panic here, and that's one thing that that this study was worried is that people are going to get in these stages where they should be treated, and they're going to get depressed,
or it can raise their anxiety level.
Raise their anxiety
which
level.
brings your blood pressure up even more.
And that's exactly what they said, Brad.
It compounds.
So they're saying for the majority of people who are at low risk and not recommended for drug treatment, about 25 million, the doctors should not label them as hypertensive. Because
Sure.
again, this is good. The doctors should support healthy choices, but if you label them once with that, they're going to say, I'm hypertensive, and they, like you said, they get anxious, they get depressed, they get, that causes all sorts of other issues.
Yeah, and it's just a snowball effect to make the person less healthy than they really need to be because they're not relaxed.
Yeah, so I think from the doctor's standpoint, what they're saying is, you recommend the healthy choices, you watch their blood pressure, and you see what happens. If it gets better on their own, obviously you didn't have to worry them in the first case. So,
speaking about hypertensive and stuff, I just thought of something, Bob. Normally you're a lot taller than me, but now when I'm sitting, you're standing. How does that look, Lonnie?
quite a contrast, I imagine. So, remember, Brad and I, we got to say it on this one, Brad.
Yeah.
We can fix just about anything
Except for
a broken heart.
Yeah.
And we can't fix high blood pressure either, apparently. So, thanks for watching.